So you're on Medicare, you're thinking about dental implants, and you've probably hit a wall, right? A wall of confusing rules, high costs. It's a lot. And you're not alone. This affects millions of people. So in this explainer, we're going to lay it all out, create a clear map to get you through all that confusion. Let's dive in. It all starts with a moment just like this, doesn't it? You're at dinner, you're with family, and suddenly a simple pleasure, it's a challenge. Missing teeth, well, they don't just affect your smile. They can really impact your confidence, your nutrition, your whole quality of life. And yeah, you've heard implants are this amazing solution, but that biggest question mark is always hanging out there, the cost, and where in the world Medicare fits into the picture. And that brings us right to the big question, the one we're really digging into today. Honestly, it's probably one of the most common and most confusing topics for anyone on Medicare. Is that program you rely on for all your other health needs actually going to step in and help you restore your smile? All right, so let's just get right to it. The short answer? Typically, no. Original Medicare does not cover dental implants. But listen to that word I just used. Typically. That one word is everything, because it means there are some really important exceptions and, thankfully, other paths to getting coverage. So first, let's break down the main rule, and then we'll go exploring those other options. Okay, first up, let's talk about the main highway here, Original Medicare. To really get why implants aren't usually covered, we've got to understand what parts A and B were designed to do in the first place. So you've got Original Medicare, right? Part A is for your hospital stays. Part B is for your doctor visits. And its whole job is to cover things that are medically necessary. And here's the catch. In most cases, Medicare looks at dental implants and basically says, yep, that's routine dental care. It puts them in the same bucket as, say, cleanings or fillings. And those generally aren't covered.
But, and this is a big but, here's where things get interesting. Even though Medicare says no to routine dental, it will sometimes step in for certain urgent medical situations. Like, let's say a dental emergency is so bad you end up in the hospital, or maybe a tooth has to be pulled before you can have major heart surgery. In cases like that, Medicare might cover it. The key thing to remember is the problem has to be directly tied to a medical issue, not just a dental one. That's the line they draw.
All right, so if Original Medicare is the main road, think of these exceptions as they're rare, but they're super crucial detours. These are those specific situations where an implant might just get covered because it crosses that line from being just dental to being medically necessary. So what does that even mean? When exactly does an implant become medically necessary in Medicare's eyes? Well, think about some serious situations. Let's say you were in an accident and lost teeth, and now you need reconstructive surgery. Or maybe treatment for oral cancer requires rebuilding your jaw. In those cases, the implants could be covered because they're part of a much bigger medical procedure. The absolute crucial point here is that the reason you need the implant has to come from a medical event, not from more common issues like tooth decay or gum disease. So what if you think your situation actually fits one of these exceptions? Well, you're going to need a really solid game plan. I got to be honest, proving medical necessity is a high bar to clear. You'll need tons of detailed paperwork from your medical doctor. And yeah, I'm stressing that, not just your dentist, that clearly shows the link between the implant and your overall medical condition. And please, 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 get pre-authorization from Medicare before you do anything. It is absolutely critical if you want to avoid a massive, surprising bill later on. Okay, so what if you're listening to all this and thinking, nope, none of those exceptions apply to me? And for most people, they won't. But don't worry, that main road isn't the only way to get there. Now let's start exploring the other major routes you can take to get help with the cost of dental implants. And this is the big one for a lot of folks. I'm talking about Medicare Advantage, which you probably also know as Part C. See, these are the plans from private insurance companies that kind of bundle everything together. Your Part A, your Part B, and usually your prescription drug coverage too. And the key thing here? A lot of them throw in extra benefits, like routine dental, vision, and hearing. And this is where that door for implant coverage really starts to crack open. But the question is, how much do these plans actually help? Well, typically they use a tiered system, kind of like a ladder. So at the bottom, you've got preventative care, like cleanings. That's often covered at or close to 100%. Great. Step up a rung, you've got basic stuff, like fillings. Maybe you get 70 to 80% coverage there. But now look at the top rung, major procedures, like implants. The coverage there often drops to 50%, or even less. And, this is important, it's always subject to the plan's annual spending limit. So while it definitely helps, it's pretty rare for it to cover the whole cost. Okay, let's put these options right next to each other so we can see what's what. With Medicare Advantage, you get that bundled convenience, but you have to watch out for those annual maximums. They usually top out somewhere between $1,000 and $3,000 a year. Then you have standalone dental plans. They're pretty similar, you just buy them separately. And you'll notice that both of these insurance options, they often have waiting periods for the big stuff for major work. Now, this third option, a dental savings plan, is a whole different animal. It is not insurance. Think of it more like a membership club, like Costco for your teeth, that gets you discounts on services. And what's the big deal about that? No waiting periods and no annual maximums. For a really expensive procedure like an implant, that can be a huge, huge advantage. All right, so we've looked at all the different routes to get coverage. Now let's talk about the cost of the trip itself. What's the real price tag here, and how can we make that number a little less scary? Okay, let's get down to brass tacks, the numbers. For just a single tooth implant, and that's the whole shebang, the post that goes in the jaw, the little connector piece, and the crown on top, you are typically looking at somewhere in the ballpark of $2,500 to $5,000. Now, that price can swing a lot depending on where you live and how complicated your case is, but it's a really solid baseline to keep in your head. But what if you need a full mouth solution, something like an all-on-4 restoration? Well, that's where the investment jumps dramatically. We're talking anywhere from $15,000 to $30,000, and get this, that's per arch. Yeah, just for the top or the bottom. When you see numbers like that, you really start to understand why squeezing every last drop out of your potential coverage is so, so important. And this really gets to the heart of the financial challenge. So let's just use an example. Say your implant costs $4,000, and your insurance plan has a pretty typical annual maximum of, say, $1,500. Well, you do the math. You're still left with a pretty significant gap that you have to cover out of your own pocket. And that right there is the reality for most people. So the big question is, how do you bridge that gap? Well, you've got some options. A lot of dental offices will have their own in-house payment plans, so definitely ask about those. If you happen to have a health savings account or a flexible spending account, you can use those pre-tax dollars, which is a big win. And hey, never underestimate the power of getting a second or even a third opinion and comparing prices. Another pro tip, ask your dentist if you can phase the treatment over time. That way, you might be able to spread the cost across 2 different insurance benefit years, letting you use your annual maximum twice. Phew, okay, we have covered a ton of ground. We've talked about the rules, the rare exceptions, all the alternative routes, and of course, the costs. So now, let's take all of that and boil it down into a clear, step-by-step action plan that you can actually use to move forward. All right. Here is your itinerary, your checklist. Step 1, pull out your current insurance paperwork. Read the fine print. You need to know exactly what you're working with. Next, go talk to the experts, the dental implant specialists. Get a consultation. And while you're at it, start researching those financing options we talked about, like payment plans or care credit. And this is huge. If you think you might have one of those medical conditions that could qualify you for an exception, start documenting everything right now. You know, when it comes right down to it, it really helps to kind of reframe this whole decision. Because yeah, on one side of the coin, it's a financial cost. It's a big expense, and it means you have to navigate this really complex insurance system. But if you flip that coin over, what are you really getting? This is an investment in your health. It's about being able to eat all the healthy, nutritious foods you love, and that affects everything from your heart to your energy levels. And let's not forget, it's about that renewed confidence that just comes from having a healthy smile you're proud of. And that's really the final thought I want to leave you with. When you look at the whole picture, the fact that you can eat better, the health benefits, that feeling of confidence, the question suddenly becomes a lot bigger than just, does my insurance cover this? It really becomes about making an investment in your overall quality of life for all the years to come. Thanks for tuning in.